There are diseases that scream, and there are diseases that whisper. Pancreatic cancer doesn't announce itself with sudden pain or dramatic warnings. It enters quietly, hides deep inside the body, and waits while life goes on as usual. That silence is exactly what makes it one of the deadliest cancers in the world. Before we go any further, if you value clear, honest conversations about health, the kind that can truly change awareness and save time, make sure you're subscribed to this channel. New videos like this come every week, and they're made for people who want to understand their bodies better. Most people who develop pancreatic cancer never felt anything serious at the beginning. Just mild discomfort, subtle digestive changes, fatigue that seemed normal, signs easy to dismiss, easy to ignore, and that's where the danger lives. Today isn't about fear. It's about awareness, especially after age 45 or 50, because when it comes to pancreatic cancer, noticing early can mean everything. To understand why pancreatic cancer is considered one of the most lethal cancers worldwide, you need to understand how it behaves inside the body. This tumor grows silently, often without changing basic blood tests in the early stages. It develops deep inside the abdomen, hidden behind the stomach and surrounded by vital structures. Because of this location, small tumors can grow for months, sometimes years, without being noticed. Unlike other organs, the pancreas doesn't send clear pain signals when something begins to go wrong. It doesn't burn, throb, or ache in an obvious way. Early changes are subtle, easy to confuse with aging, stress, or common digestive issues. Even healthcare professionals may initially interpret these signs as harmless. When classic symptoms finally appear, the disease is often already advanced. At that stage, treatment options become limited and survival rates drop sharply. This isn't because medicine hasn't progressed, it's because time was lost without realizing it. That's why awareness matters more than fear. The pancreas plays a critical role in your survival, even though most people rarely think about it. It produces digestive enzymes that allow your body to absorb fats, proteins, and carbohydrates. It also releases hormones like insulin that regulate blood sugar levels. When this organ begins to fail, the earliest symptoms reflect exactly those functions. Digestion no longer feels the same. Blood sugar starts behaving unpredictably. Meals that once felt normal now lead to discomfort, bloating, or fatigue. There may be a lingering sense that something is off, without a clear explanation. None of this feels dramatic. None of it sounds like cancer. That's the trap. After the age of 45 or 50, the body becomes more vulnerable to cellular damage, chronic inflammation, and metabolic changes. Over time, risk factors such as smoking history, insulin resistance, poor diet, and sedentary lifestyle quietly increase pressure on pancreatic tissue. The body adapts. The disease advances. And the warnings remain subtle. One of the earliest warning signs is a persistent, poorly defined discomfort in the upper abdomen. It's not sharp pain. It doesn't stop your day. It feels more like pressure, heaviness, or a vague unease that comes and goes. Because it isn't intense, most people dismiss it. They blame stress, gastritis, reflux, gas, or a heavy meal. They take common medications and move on. The concern begins when that discomfort doesn't fully disappear. Weeks pass, sometimes months. The sensation returns again and again without a clear pattern. It may not be tied to eating, exercise, or posture, which makes it even harder to explain. This is often where time is lost. The pancreas sits deep in the abdomen, behind the stomach. When something begins to grow or change there, the body rarely reacts with obvious pain. Instead, it whispers through sensations that feel easy to ignore until they become impossible to overlook. Another early sign that is often misunderstood is pain in the back with no clear cause. This isn't the typical muscle soreness from physical effort or poor posture. It usually feels deep, dull, and constant, located in the upper or middle back. What makes it confusing is that it doesn't behave like ordinary back pain. Rest doesn't fully relieve it. Stretching brings little improvement. Painkillers may help temporarily, but the discomfort keeps returning. Many people assume it's related to age, stress, or spine issues and never look beyond that explanation. But anatomically, the pancreas lies very close to the spine and major nerve pathways. When a tumor begins to develop, it can irritate these nerves and cause pain that radiates straight to the back. Because the pain seems orthopedic, investigations are delayed. And once again, valuable time quietly slips away. Losing weight without trying may sound like good news at first, especially later in life. But when weight drops steadily with no change in diet or physical activity, it's a warning sign that should never be ignored. In pancreatic cancer, this happens for two main reasons. First, the pancreas begins to fail at producing enough digestive enzymes. Without them, the body can't properly absorb fats and nutrients, even when you're eating normally. Second, the tumor itself consumes energy and creates a chronic inflammatory state. Muscle mass decreases. Fat stores disappear. The body enters a silent catabolic mode. Many people also notice a reduced appetite or feel full after just a few bites. Meals that once felt satisfying now feel heavy or unappealing. This combination, weight loss, early fullness, and fatigue, is not a normal part of aging. It's the body signaling that something deeper is wrong. Some of the most telling warning signs appear quietly in digestion, often dismissed or never mentioned at all. Changes in bowel movements may feel uncomfortable to talk about, but they matter. Stools that become lighter in color, greasy, unusually foul-smelling, or that float in the toilet can signal fat malabsorption. This happens when the pancreas can no longer release enough enzymes to break down fats properly. Bloating after meals, increased gas, and a sense that food just sits in the stomach may also appear. These symptoms don't usually arrive suddenly. They creep in, slowly becoming part of a new normal. Many people assume this is just aging, stress, or something they ate. They self-medicate, adjust meals, and move on. But when these digestive changes persist for weeks or months, they are not random. They are biochemical signals that digestion is no longer working the way it should. Ignoring them means ignoring one of the body's earliest warning systems. Developing diabetes later in life can feel sudden and confusing, especially for people with no prior history of blood sugar problems. But in some cases, this change is more than a metabolic coincidence. The pancreas plays a central role in blood sugar control through insulin production. When a tumor begins to interfere with this process, glucose levels can rise abruptly. What raises concern is diabetes that appears after age 50 and proves unusually difficult to control, even with medication, diet changes, or weight loss. Blood sugar seems unstable. Numbers fluctuate without a clear explanation. In certain situations, diabetes is not just a risk factor for pancreatic cancer. It can be an early warning sign. Inflammation caused by the tumor reduces the body's sensitivity to insulin or disrupts its production altogether. When new diabetes appears alongside weight loss, fatigue, or digestive issues, it deserves careful medical attention. The body may be signaling a deeper imbalance that goes far beyond blood sugar alone. Yellowing of the skin or eyes rarely appears suddenly in the early stages. More often, it begins so subtly that people don't notice it at all. A slight change in skin tone, eyes that look a bit dull or yellow under certain light, persistent itching without an obvious cause. These changes happen when a growing tumor partially blocks the bile ducts, slowing the normal flow of bile. As bile builds up in the bloodstream, the skin and eyes gradually change color. Urine may become darker. Stools may turn lighter. The skin may itch constantly, even without a rash. Because the process is slow, many people blame dehydration, liver issues, or medications. But painless jaundice, especially when paired with digestive changes or weight loss, is a red flag. The body is quietly struggling to eliminate waste products, and the skin becomes its messenger. This isn't ordinary tiredness. It's a deep, persistent fatigue that doesn't improve with rest, sleep, or a lighter schedule. People describe it as moving through the day with a heavy body, a foggy mind, and a constant lack of energy. Concentration becomes harder. Motivation fades. Simple tasks feel draining. This kind of fatigue is driven by systemic inflammation, metabolic disruption, and the silent energy demands of the disease itself. The body is working harder just to maintain balance. What makes this especially dangerous is that fatigue is often blamed on age, stress, or routine life demands. But pancreatic cancer rarely announces itself with one dramatic symptom. It reveals itself through patterns. Persistent abdominal discomfort combined with back pain. Unintentional weight loss paired with digestive changes. New diabetes alongside overwhelming fatigue. The body doesn't scream. It whispers, repeatedly. If your body has been sending you quiet signals, which ones have you been explaining away as normal or temporary? Share in the comments what symptoms surprised you the most, or what changes you've noticed but never connected before. Your experience might help someone else recognize a warning in time. If this content helped you see your health differently, subscribe to the channel and stay with us. A recommended video is appearing on your screen now, one that goes deeper into signs your body reveals before serious illness shows up. Will you listen to your body the next time it whispers, or wait until it has no choice but to shout?